Welcome to BW Healthcare World 40 Under 40 Awards and Summit. The very first question I would like to ask you is, how can healthcare institutions create a culture where patient safety is prioritized, and how can patients be more actively engaged in their own safety?
A safety culture includes, first of all, identifying the harm that can happen freely, frankly, and reporting incidents of harm that keep occurring. The culture doesn't only stay in the hospitals, it goes before people reach hospitals and it goes after people go back home. So I just want to widen this horizon first of all, so that patients get engaged. The second is identifying and creating awareness about possible harms, what are the signs and symptoms of harm, and what is the protective measures to prevent or mitigate that harm. That is patient education, and a mass scale, robust education program which goes through various channels at various touch points in the patient journey and the care pathway, meaning right from before they take the first appointment, the OPD, the consultation, the tests, the treatment time if they are admitted in the IP sections, and at the discharge and post-discharge follow-up. So at all the points in the journey of a patient, the care and the touching and the education must go on. The second is, as a culture, if the incidents are reported, if they are analyzed, and if the root cause comes out, the solutions will automatically come. Celebrate people who report. Give them rewards and awards for people who report. Do not punish them. In fact, and once the cure is done, once the recipe is done, announce it to the patient world. Trust me, the transparency, the honesty will get more accolades, more loyalty, and more trust. This in turn will reinforce a culture of openness, honesty, and progress. So the end result for the hospital is more loyal patients, more referrals, more business. So it's a beneficial to both.
And what are the most effective strategies for protecting healthcare professionals who report errors, thereby fostering a culture of transparency and continuous improvement?
Okay, I think I answered part of that, but I will once again create what we call a patient advisory council, create what we call forums of specialization care, and create this in every department, create this across departments. Let teams from different departments, whether it is diagnostic, diet, pharmacy, or actual clinical and nursing, come together and pick up a topic and discuss the different reasons, causes, and possible solutions. So it doesn't devolve only on one department. So there is no fear that because of me this happened. So also the answers will also credit multiple departments, multiple disciplines. So it's a collective thing. So building a team is one of the strategies. How do you build patients into this team? Patient advisory councils is a structured method of having people on board from the patient community as well as from the healthcare providers community. Together, they identify the key problems, chronic problems, they find solutions, and they give back the best practices both to the patient community as well as institutionalizes. So once it gets into training programs, once it gets into medical school curriculums, once it gets into MHA hospital curriculums, then it stays sustainable and just gets bigger, better, and wider. So that's what I would recommend.
Thank you so much, ma'am. Pleasure talking to you.
Thank you.